guys. I wanted to do an antibiotics and overview, part one, beta lactams. I originally wanted to put all the antibiotics into one lecture, but it was just way too much content, and I thought it'd just be easier to break it up into parts. Otherwise, the videos would go on for a really long time, almost about half an hour. And I usually like it if videos tend to be in short chunks of 10 minutes and stuff because short attention span and all that. But yeah, so let's just dive right in. So I think the best way to kind of understand antibiotics is kind of understanding the targets. And I don't mean in terms of mechanism of action, I mean sort of like what kind of bacteria they affect. So you already know about gram positives and gram negatives. Then you got your atypicals, and then you also got your anaerobes. Now, for the gram positives, I colored it purple and blue, just so you kind of understand that on a gram stain, this is the color you'd be looking for to identify a gram-positive bacteria. I'm not going to read out all the bacteria. It's kind of just there for you to kind of look at so you kind of have an idea. Oh, also in terms of gram negatives, uh, on a gram stain, they will be a pinkish reddish color. Atypicals will be colorless. And then anaerobes, well, they kind of do a different test for that. But yeah, so the names are kind of just kind of like there. Uh, Honestly, if you kind of know the gram positives, because it's only a short list, Streptococcus, Staphylococcus, Enterococcus. Like Staphylococcus, you should already know by now. Like you run into that so much with Staphylococcus aureus, MRSA, MSSA. So that one's pretty easy. But if you know like which ones are the positives, it kind of makes antibiotics a little bit easier. Gram negatives, there's a bit a lot, but usually I can. It's usually kind of like make to this. I shouldn't be saying this, but it's usually safe to assume like if you kind of don't recognize the bacteria, usually most of the time it'll be a gram negative. And then these ones, the atypicals, I would say you'll probably see these ones mostly in pneumonia. Um, Oh, God, it's really hard to really write with a mouse. But anyways, you'll see this in pneumonia. I'll put it PNU for short for pneumonia as well. And then anaerobes, Clostridium, Bacteroides. You'll probably see this more like intestinal infections. Clostridium difficile is a very popular one, so you tend to see that one with the intestines, and that's going to be characterized by like high diarrhea. Okay. Oh yeah. So just so you guys know, just for the next slides, I'm not going to really bother with the mechanism of action because I'm already going with the assumption that you already know this. It's just sort of like you just need to know the other broader details about the medications, such as like their high yield indications, like what kind of treatments you do them for, adverse drug reactions, and maybe other special things you need to know as well. So let's start off with, the bread and butter, which is the penicillins. So we got penicillin G and penicillin V. Penicillin G is usually given IM or IV, and penicillin V will tend to be your PO dosing, and they cover mainly gram-positive bacterias. You'll usually see this more for syphilis, penicillin G especially, and strep pharyngitis, and dental infections or rheumatic fever. If you work in a pharmacy, you'll usually see penicillin V prescribed as antibiotic treatment sometimes. And then you got your cloxacillins. Only thing you need to know about this one is it's used mainly for MSSA, not MRSA. And then you got your aminopenicillins. So this is probably the ones you'll usually think about when you hear of beta lactams. So that's your amoxicillin. You'll often give this one PO. And for children's dosing, the question you'll often get asked with the liquid dose is um, the storage of the medication. And usually what they'll do to trip you up is they'll say room temperature because I think most people will go in the understanding that it's 14 days, but that's if it's refrigerated. So it's only good for 7 days stability if you keep it at room temperature and then 14 days refrigerated. So oftentimes when we hand out the medication, we usually tell them to refrigerate it, but that's not absolutely required, but it does help keep the stability for the medication longer. And then ampicillin is another one. You'll often see this as parenteral, but you can also give an PO dose for that one as well. And they both cover gram-positive and negatives. Um, Common side effects with this class you'll usually run into is probably just, the usual nausea, vomiting, headache, diarrhea. Um, those aren't usually guaranteed to occur, but those are the ones that you'll probably usually see, diarrhea especially. So indicated for the popular one is probably acute otitis media. That's like the main one you'll usually see amoxicillin treated for. Then there's strep throat, listeria, and then H. pylori in quadruple therapy, and also triple therapy in certain places as well. Okay, so let's just go over the amoxicillin, but more specifically when you have bacterial resistance present. So that's when bacteria have the beta lactamase inhibitors. And so an example you might see is the clavulin component, which creates amoxiclav. And this combination will have a higher incidence of diarrhea. So generally with the liquid dosing, when you give it to kids, you'll try to go for a strength that has the lowest amount of clavulin in that dose to offset the side effect of diarrhea. And this one has really good combination. It covers gram positive, gram negative, and anaerobes. Some indications you'll see is acute sinusitis, anobites, aspiration pneumonia, and then of course acute otitis media, which is you usually see it if amoxicillin treatment failed. You'll add this one on top to fight the resistance. Now, just something to go over is usually when we think of penicillin allergies, our first one is usually amoxicillin, just because how common it is in the community. So if that patient develops a macular papular rash and it appears after 7 to 10 days, this is usually we define as like a delayed hypersensitivity reaction, and this is usually non-threatening. And what that means is this patient can then, like if they have the penicillin allergy, so this is why it's really important to ask for allergies. If they have this allergy, that means we'll be able to switch them to another class of beta lactams, and usually the common one is usually something like cephalexin, for example. Now, if anaphylaxis or urticaria, which is hives, appear within 1 hour, this is an immediate hypersensitivity reaction, and it's usually life-threatening. So it's usually best to avoid all penicillins and beta-lactams as the risks outweigh the benefits. So in this case, you might switch them to something else, such as like a fluoroquinolone. All right, so Piptaz. Okay, so Piptaz is usually given IV. It's known as piperacillin tazobactam. It covers gram positive, gram negative, and especially Pseudomonas. Pseudomonas is like the I don't know how to explain it. Maybe like the best way to explain it is kind of like it's like MRSA, where you can only use certain things to kill it. And there's only a few antibiotics that work on Pseudomonas, and you'll see a few of them in this lecture as well. And also anaerobes. Now, basically, this is like the nuclear option. This is reserved for like severe infections. Usually, you'll be in soft tissue infections or intra-abdominal infections. Now, just watch out for the hypersensitivity reactions, like the ones we just talked in the earlier slides. And there is some hematological reactions, and diarrhea is high with this one. Oh, and it's also the class is anti-pseudomonal penicillins. But I really doubt you'll get asked on that. So beta lactams. Let's start off with the cephalosporins. As you go from first generation to fourth generation, the gram positive coverage decreases, but your gram positive negative coverage will increase as you go up in the generations. Um, Technically, this should be fifth generation, but anyways, first generation. Oh, actually, I know why I wrote it as fourth generation because there is still a little bit of gram positive coverage, but the fifth generation I think only covers only gram negative. Anyway, sorry, that's neither here nor there. First generation cephalexin and cefazolin. You'll often see this in skin infections where MSSA is susceptible. Cefazolin usually is used in surgery prophylaxis, but you can also will also see in a lot of gram positive infections as well. Then you got your second gens, which is cefotaxime, cefuroximine, cefaclor, cefoten. And a way to remember this, and shout out to Cram the Pants YouTube channel for giving this mnemonic. It's two furry fox drinking tea on the floor. So that's how you can kind of remember the second gens. And they have good coverage for gram-positive, negative, anaerobes. And due to the anaerobic coverage, it's really good for pelvic and some intra-abdominal infections. Next is your third gens, which is your ceftriaxone, cefotaximine, and cefozyme. Um, so this one, shout out to Cram the Pants again for giving this a moment. It's you can try taxing me, but you won't get a dime. Try right over here, and then try is also kind of to make you remember that it is the third gens. So you can try taxing me, but you won't get a dime. There's a way to remember the third gens. They have excellent gram-negative coverage, including Pseudomonas with ceftizidime. And the way to remember this is if you sue me, you won't get a dime or pie. Um, I keep this one in here because this refers to the fourth generation, which I'm just gonna get to in just a moment. So these classes are usually good for gonococcal infections, meningitis, or community-acquired pneumonia, which is hospitalized. Okay, so now on to your fourth gen. So cefepime. And the way I remember this one is the four slices of pie. Fourth referring to the fourth generation, and pi, which is going to refer to cefepime, which I also underlined here with if you sue me, you won't get a dime or pie. Um, so the reason I split that is because it also covers Pseudomonas and other gram negatives as well. So try to remember that of the cephalosporins, that it is ceftizidime and cefepime. Just another thing to know, it can cause seizures because it lowers the threshold as well. And then we got our last gen, which is the fifth generation, which is ceftaroline, the star with 5 points and has MRSA coverage. Okay, I do want to go back because I think I might have confused a few people with Oh, I can't go back. Okay. Well, I wanted to clarify. So I think I said with the first to fourth gen, it should say fifth gen, but we're just gonna ignore that. First to fourth gen because MRSA, as you know, is a gram-positive bacteria. All right, and now we got the monobactams, and this one includes Aztrionam. And honestly, I've never really seen this bacteria that much. I think you'll probably see it more in hospitals because you only use it for gram-negative coverage only, which also includes Pseudomonas as well. It's has no cross-reactivity with other beta-lactams, so this means it's okay to give as an alternative in penicillin allergies. It can also be used in renal. Okay, so this one is our beta-lactams, also known as the carbapenems. So we got imipenem, which is often seen in combination with celastin to protect renal tubules, meropenem, and ertapenem. Remember E for exception. They're extremely broad spectrum coverage, so they cover gram-positive, gram-negative, and anaerobes. However, they do not cover MRSA and atypicals. Ertapenem is the only one that does not cover Pseudomonas, um, where the other ones do cover Pseudomonas. And then some adverse drug reactions is CNX toxicity and a lower Caesar threshold. This is higher with imipenem. You also note that carbapenems are really good for ESBL producing organisms. Extended spectrum beta lactamase producing organisms. So this is one with higher resistance. You might most likely will run into this in pyelonephritis, which is a UTI infection that affects the upper kidney. And also note that there is a 1% cross-reactivity with penicillin allergies as well. Okay. Uh, okay, and then yeah, so that covers pretty much antibiotics part one. Um, Let me know if this kind of helps and if you want me to make more videos. I'll probably come out with a part two and part three, just kind of for my own studying as well, but obviously I'll share it with people on YouTube to see if they need it. So thank you and good luck on your exams, guys.